This podcast will educate and inform listeners on the various systems and methods that use information, data, and communication technologies to help resolve problems, reduce inefficiencies and costs, improve access, increase quality, and help make the practice of medicine more personalized and precise.
Welcome to SMA's Digital Health and Innovation Podcast. I'm your host, Dr. Andy Mohan, SMA's Digital Health and Innovation Chair. Today, we are discussing the socioeconomic inequities and mental health impacts of a pandemic. Our guest today is Dr. Anandhi Narasimhan. Dr. Narasimhan is a child, adolescent, and adult psychiatrist in Los Angeles, California. She has had numerous media appearances, including CNN, CNN International, USA Today, The Tavis Smiley Show, Fox News, Vice, etc. Dr. Narasimhan also received the Hind Ratan Award or Jewel of India Award for her contributions to medicine and media. She is also an asylum evaluator for Physicians for Human Rights and involved in research looking into using digital therapeutics and artificial intelligence to improve early detection and interventions. Our moderator today is Mr. Fred Newmark. Mr. Newmark consults as the co-founder and managing partner of Newmark Healthcare Services, working with physicians, hospitals, and group practices. He also has a video series called Behind the Curtain of Healthcare that can be found on YouTube. Dr. Narasimhan and Mr. Newmark, it is an honor and a pleasure to have you on the show today. So without further ado, let's get started with the discussion. Before we get started, SMA podcasts are available on iTunes, Google Play, Spotify, YouTube, iHeartRadio, or Stitcher Radio.
Hey, Dr. Narasimhan, we are so delighted you would take time for our podcast today. Thank you for joining us.
Thank you for having me.
Of course. And I have to say, your paper entitled A Review of Mental Health Responses to Pandemics is a must read. I know you're working on having it published, and I found it fascinating. Some of the pieces you focus on, extremely insightful, as well as discussing some of the changes that we probably need to make from a delivery of care and just public awareness. So thank you for sharing that, which we'll cover that in our conversation today, very specific to the pandemic. And I wanted to just start with a question that would ask, what are some of the most common causes that you see for the rise of mental illness during a pandemic environment that we're experiencing right now?
Yeah, so, I wrote this paper because, one, I wanted to get myself more familiar with the research on previous outbreaks and how people responded and what could be done to help them. And I was particularly interested because I wanted to make sure I was allocating resources and approaching my patient care with acquired knowledge from how things have been handled in the past. So, what we are seeing is that there is a profound effect on people and their mental health with outbreaks historically, and I'm seeing it even presently with my patient population and people that I know. I have actually a personal history related to outbreaks myself. My grandfather was affected by the typhoid epidemic between 1929 and 1933 in India. He lost his first wife and his other relatives to the typhoid epidemic, and he himself had it, but he survived. It's interesting, it was his brother and his wife he lost during the typhoid epidemic. So it just shows that a pandemic or an outbreak can affect the trajectory of the whole family history. So I'm aware of that personally, and I'm also aware of that in the construct of our society and what I'm seeing and what I'm hearing about.
So some of the things that I think have affected many, probably in varying degrees. I mean, I've seen quite lately some shows on the news, if you will, or some interviews with other behavioral health experts that discuss the the challenges of stress, anxiety, isolation in regards to deepening the crisis on the behavioral health side. Are those kind of the ABCs, or are there some other components that you'd want to talk about that seem to be significantly impacting the spike in mental illness right now?
Yeah, so prior research has showed that with both healthcare professionals and patients, there can be more stress, there can be a feeling of feeling traumatized, they can have higher levels of depression and anxiety. And there's also the association that the higher the risk of exposure, the more anxiety and fear arises, as well as fear of spreading the infection to family members and partners. And I think for healthcare workers in particular, they find themselves having to negotiate this balance between their, professional duties and their own fears and anxiety and their sense of altruism. So that can create conflict. What also has been noticed previously and currently is a couple of things that there are high risk populations that are at a higher risk for the development and the mortality associated with COVID. So this is important because we do need to target preventive efforts to those high risk populations, both physically and mentally. And some of these groups, including, the elderly, immunocompromised, those who are living in like board and care homes or nursing homes, and those who already have existing medical or psychiatric or substance use problems. And of course, as I mentioned, healthcare workers. So that's, one thing that we're seeing. The second thing is that it is undeniable the profound racial disparities that COVID is laying bare. African Americans have had 3 times the rate of infection rate, and they have a 6 times higher death rate when compared to white majority counties. So this contrast is stark, and it shows racial disparities. Over time, we will get data on how other confounding variables can affect the actual data, but when you control for those things, it's still pretty stark, the disparity. And part of that is due to a lot of African Americans who are essential workers who can't afford the privilege of social distancing their workplace and are at home. So these are things that are not minor and not benign, and we need to address. The other population that I want to talk about is people who are victims of intimate partner violence and child abuse. So those are 2 categories that are really vulnerable during this time for multiple reasons, and I can elaborate further on that. Those are just a list of, some of the, high risk populations and the people that I am concerned about, both as a psychiatrist and as a physician.
And I would include, and I know to your point, the disproportionate impact on African Americans. And I would include, from what the little bit I have seen, Hispanic Latinos, if you will, are
Right.
in the group. And generally, I don't know if it's the politically correct thing to say people of color, but I think it's a broad group. But one thing that, very candidly, it's been enlightening for me, because I do not come from a poor socioeconomic background, if you will, or an underprivileged environment or a high crime environment. I had every economic advantage growing up, grew up in a fairly, secure middle class environment. I wouldn't say affluent, but I would say healthcare was available. And it's really, for me, honestly, pulled the Band-Aid off because of the pandemic and because of the data that you're alluding to, that it's evident that there's a weave of issues, and it's not just one thing. It's not just not having healthcare nearby, or it's not just perhaps a high crime rate. It seemingly has a confluence of things. Is there anything that you'd want to address specific to that?
Yeah, and to your point about other communities of color, during the H1N1 influenza outbreak, Native Americans died at a a rate 4 times higher, greater than the national rate. So I agree with you on those as well. So a lot of healthcare disparities and healthcare outcomes have to do with what we call social determinants. As healthcare workers, we like to think we have so much power and we can really influence people's lives and, save them. But a lot of outcomes are due to social determinants, which means like where one lives, such as if you live in an area where it's high density, whether there's crime in your neighborhoods, whether you have access to resources like healthy food. I once worked in a clinic where there was, I'd go out during my lunch break and there was nothing healthy within like a 4-block radius. There was no place I could go where I could get anything healthy. It was just mostly fast food chains. And then other socioeconomic factors that affect healthcare outcomes. So these are things that can determine how someone responds to the illness and how they can recover from the illness and what kind of care that they give. When we look at prior data, for example, with maternal mortality rates, we know that even an educated African American woman tends to have poorer outcomes than a white woman when it comes to maternal outcomes after childbirth. We have to explore why that is and what we can do about it. Another example is African Americans are consistently undertreated with respect to pain in hospital settings. They've done a survey of medical students. Almost half of medical students thought that African Americans feel less pain than white Americans. So we have to address these differences at a very fundamental level in our educational system so that we can correct these biases and we can correct the effects of these biases.
And this is a little redundant, but again, not fitting into that population, if you will, that would, as you put it, social detriments. And I was taking notes. Thank you for sharing that. This has been a quite eye-opening time for me as well. And it's just the times that we're in. And I agree, this is the time to explore in a deeper level some of these questions and scenarios. Question I have for you, are you able to in any way discuss or speak on the increase in behavioral health challenges for people that did not have any prior predisposition prior to the pandemic? I don't know if there's any data or any anecdotal experiences you can share with us. I could
Yes.
definitely see people that have already are suffering from, pre-diagnosed challenges. I'm curious to hear what is now appearing, anything you could share with people that didn't necessarily present as having a behavioral health challenge prior to the pandemic.
Prior research has also shown that even if you haven't suffered from mental illness, you're also at a higher risk during an outbreak to developing symptoms of mental illness. So you don't have to have an underlying history of mental illness. What I am seeing, it's kind of interesting because for some people, the stay-at-home measures or social distancing measures have actually been restorative. For a lot of parents who are so used to having to take their kids around to different places and make sure they get to all their activities, have actually found it kind of relaxing that they can stay at home and that they can have quality family time and eat meals together. So that's increased a sense of connection and well-being. And same for people who have arduous commutes, who are able to work from home now and, pay attention to kind of their diet and other things because they just have a little bit more time to do so. On the other hand, and also I want to add one other group, people who have some social anxiety, who, everyday challenges of interacting with others is a source of stress and anxiety, can actually find it a bit of a relief not to have these forced interactions. On the other hand, it has caused an increase in like depressive symptoms and anxiety in so many. For some of my patients or people who deal with addiction, and having a routine, having someplace they go every day, going to meetings in person, this provides a lot of structure for them, and not
Yeah.
having that can actually increase their cravings even for substances. So I'm actually seeing a wide variety of reactions, both positive and negative, depending on the individual.
I hadn't thought about some positive impacts of the pandemic, so I appreciate you sharing that. And I could actually see that based on the couple of things you shared as to why it's actually perhaps been a relief for some during this time. One thing I wanted to ask you about, being a professional, in behavioral health as you are, a psychiatrist, why do you think, if you will, that the public health authorities, if you will, and media don't provide, I'm going to say they provide disproportionate measure of focus on mental well-being versus just physical well-being? And I'm gonna steal a statistic that came off of Chris Cuomo's show last week. So if the information is good, we can thank Chris. If it's not, we can blame Chris, not me. But he indicated that the federal government had provided $2.5 trillion of overall approved COVID relief, and only 425 million for mental health, which he said was approximately 1/100%. Not that $425 million isn't something, but it clearly doesn't necessarily carry the same kind of support. And so why is it, do you feel, that we don't conflate wellness in the physical side in alignment with mental, and it still gets kind of less coverage than just physical well-being?
Yeah, so historically, this has been the norm, that whenever there has been an outbreak, the attention and media coverage has been more on the physical effects and the physical ramifications, and less on the behavioral health side. Although with this pandemic, there have been increasing calls internationally that there should be more attention to mental health. And part of, with policy making and funding, so much of it is due because you have representation from the community. So what it shows me is that we need more mental health officials who are involved in some of these policies, and getting them to happen so that there is allocation to the mental health effects. The other interesting thing to note is that actually prior research also shows that it's important that there be mental health professionals involved in the messaging coming from our leadership, coming from the government, coming from public health authorities. Because when society is faced with something like a pandemic, the messaging is really important. When you have a lot of conflicting messages that vary from different health authorities, and even within different communities and different states, it actually increases the feeling of uncertainty, it increases the feeling of anxiety, and actually this kind of emotional stress as a result can cause people to violate some of the recommended public health measures. So how the messaging goes is really important. So I think that those are some of the things I would note about why that is, or kind of examples of how that goes. But and also remember, mental health has been stigmatized in society for a very, very long time, and we are fighting that. We're fighting the
Yeah.
stigma,
Yeah.
and we are asking for equity, even among our other physician colleagues and other healthcare workers. We have to continue to advocate for our patients. Millions of Americans suffer from mental illness, so it doesn't behoove us as a society in any way to neglect the existence of it.
I'm glad you touched on stigmatization because if you hadn't said it, I was going to bring it up. And I will share with you that even in my own life, I saw it as as a stigma, and I feel that I'm a fairly broad-minded person, and this, it's odd, perhaps what gets into one's awareness as to why you get more comfortable with something. But I am a huge sports fan, and a few years ago, I saw more and more athletes, if you will, talking about that they had sought treatment, and it suddenly, for some reason or many reasons, got more comfortable for me, because truly, as odd as it sounds, because I heard public figures, actually NBA players in other sports, coming forward and talking about their own personal situations and how seeking help was incredible. And after hearing that, probably a short time after hearing that, I went through probably maybe a year and a quarter of cognitive behavioral therapy. And I say it very openly and candidly because of how much good it did for me. And I will tell you candidly, in my own life experience, I don't think that there's anybody that wouldn't benefit from getting the kind of care that I know I received. So I would encourage anyone that thinks they need help, whether it's the kind of extreme situation, of course, is the focus of our podcast, but just day over day living and stresses or family situations. Or so sorry to hog so much of the airtime with this self-disclosure, but I just thought it was important because the word, it has been such a stigmatizing thing in society, and hopefully we're headed in a different direction, and
Right.
people continue to reach out more and more.
I appreciate athletes and other celebrities who've spoken out about their own struggles with mental health, because I think for a lot of men, they see it as a sign of weakness if they have any mental health struggles, or they're dealing with it. And to have these individuals who've demonstrated robust physical fortitude in their athletic activity, it's actually inspiring, and it helps us open up about our own vulnerabilities, I think. So having actors or athletes discuss this in an open way is very powerful, and I
Yes.
think it's great for starters. And secondly, I wanted to comment a bit on your point about the preventative effects of mental health care. I was just having a conversation with a parent recently about how there's data that if we apply some therapeutic preventive mental health measures in children, in young children, you can actually build their resilience and help them develop positive coping skills before they develop any mental health symptoms. And it can keep some of the mental health symptoms at bay. And I think that's really important because a lot of mental health has not been focused on primary prevention the way we talk about it, preventing diabetes or preventing high blood
Yep.
pressure or cholesterol. We have
Yep.
primary care doctors have all these messages. Hey, exercise, diet,
Yep.
have a healthy diet. But we haven't done that with mental health as much. And I think that is important. And I think if you can imagine, when you're dealing with children and you're able to alter the trajectory of their life if they learn some positive coping skills. And I think that can help even with the challenges of this pandemic. If you have more resilience and
Yes.
you're able to cope better, it's better for you, it's better for your family, and it's better for all of society.
So, Dr. Narasimhan, where were you 60 years ago when I needed you most?
60 years ago, I don't, it was a previous lifetime, and I don't have a lens into where I was in my
Yeah,
previous lifetime.
the messaging for that last important sharing that you gave us just didn't seem to resonate in our family. So that was my shot at humor,
Well,
to
I'll
say
give
that.
you my shot at
Yes.
humor.
Yes.
Anytime I'm going through a struggle,
Yes.
personally or otherwise,
Yes.
sometimes I think to myself, I obviously sinned in my past life.
Well, we all are human, right? We are all
Yeah.
subject to the similar challenges. One thing, and it actually was not on my Q question, but I'm glad you brought it up. Can you talk for a moment about productive ways for adults to be discussing the pandemic with children so that they can absorb it in a way? Is there particularly a certain age, at a young age, that you don't even bring it up because of the fear perhaps that it could inappropriately create? Any insight you could give on what those conversations should look like or could look like would be great.
Sure. So I think for starters, parents or educators, or anyone else who's involved with children, we have to focus on our own self-healing first. So if you're completely strung out and anxious, you're gonna project that onto the child. So part of it is kind of dealing with your own anxiety and fears and just kind of understanding it. I mean, you're gonna have these feelings, but just, understanding how they arise and how you're dealing with it in a reflective way can be very useful before you begin to interact with a child. As far as how you explain this to children, for starters, children are a lot more perceptive than we give them credit for usually, so they're a lot more aware of things even if we're not talking about it. And actually, not talking about it can be harmful. Children would benefit from knowing why they can't go to school or why they can't play with their friends as much as they used to, because they'll
Mm-hmm.
have concerns about those things.
Mm-hmm.
Also, the way you speak to a child about this pandemic should be age appropriate, developing based on their developmental age. So, for a really young child, like an infant or toddler, you want to speak about it in a way that is palatable and something that's developmentally appropriate that they can understand. So, with young children, you might want to say, well, let's talk about germs. This virus is a germ and we need to wash our hands so we don't get the germ. Like, so kind of even making a game out of it, or having them earn points if they do these things for a reward. So those things can be useful. In an older child, you can be a little bit more sophisticated in the discussions and monitor how they're feeling. And with all children, you want to monitor how they're feeling and validate their feelings. If they're afraid that you're going to get sick or they're going to get sick, kind of discuss that and allow them to express it and validate it, and say, well, the adults around you, we are trying to do things to prevent us from getting sick and prevent grandma and grandpa from getting the virus. So these can be productive conversations, and it can help reduce the child's anxiety as well. And also, most parents I've spoken to have had to resort to some real innovative methods in keeping their children occupied during this time, and figuring out how they can allow them to have some socialization and structure in the context of trying to protect their physical health.
No, and I know that children perceive things the way that they're going to perceive them, and I just believe it's so mindful how we communicate during stressful times. And children can believe that things are their fault, or perhaps, and maybe I'm going out on a limb here, but if you don't explain why it's best to social distance or why they can't see their friends, their own thought processes could lead them to make some very inappropriate conclusions about those reasons. So I would suppose it's important on their level to explain, some of those changes.
Also, I want to add, you want to limit the amount of content you expose them to in terms of news and pandemic related news and mortality rates and all that, because what we found from the data from 9/11 was that children who saw repeated images of the events of 9/11 had more symptoms of post-traumatic stress disorder. So monitoring the media content and what they're getting is also useful to, alleviate anxiety and not to cause more stress.
Yeah, I'd apply some of that sage advice you just gave to the adult sector as well, myself included,
Right.
by the way.
Right. Right, right. Yeah.
So I wanted to give you an opportunity because you touched on it earlier. You mentioned partner violence, child abuse, and neglect. What would you say, or how would you explain that these dynamics actually can worsen based on a pandemic and the times we're facing right now? I'd love for you to expound on that a little bit.
Yes, this is something I have a lot of concern about, the patient population that I treat and just members of society in general. We know that approximately 1 in 4 women and nearly 1 in 10 men have experienced some level of intimate partner violence during their lifetime. So, and we also know that that causes a lot of psychological effects and physical effects. About 16% of homicide victims, that's 1 in 6, are killed during intimate partner violence.
Hmm.
So, you know, in addition, there's lots of consequences to your mental and physical health. So, the thing that happens is when people are in a particularly vulnerable situation like intimate partner violence, it takes a lot of courage to leave such circumstances. It takes a lot to feel empowered and to fight the psychological dismantling that happens
Mm-hmm.
during intimate partner violence. So already that person is in this precarious situation where they have to try and lift themselves out of, and that's why it's so hard. And one of the things, you know, a supervisor once told me when I was in training, we must never judge people who, especially women who don't leave domestic violence situations, because often, a lot of times, their life is at biggest risk when they try to leave. So can't judge them for staying and having apprehension about leaving. As it is, when people are in these situations, they may worry about how they're going to take care of their children if they leave, how they're going to support themselves financially, because a lot of them are dependent on their partner for finances. So there's all these confounding factors that kind of deter them from leaving. So this is already exists, but then you add the challenge of this happening during a pandemic. For starters, if people are working from home and they're not going out, it can increase the risk of intimate partner violence happening at home because they're spending more time together. And secondly, you know, we always ask victims to have a safety plan in mind, have a bag packed, have, you know, somewhere you can go. Is there a friend or family member that you can, you know, run to if you need to? And during this time, that safety plan may have to change because that friend or other family member may not even allow people to come in because they're afraid of getting the virus. So that pre-existing safety plan may have to be modified. Even there are a lot of people who worry that even filing a restraining order may not be like a simple thing to do during this time.
Mm-hmm.
So, and then, you know, escaping to a hotel or like other rental property may increase your fears of, hey, if I go to one of these places, am I going to get the virus, or my children going to get the virus?
Mm-hmm.
So these are all complexities that exist. So what that means and what that tells us is that we have to have some leniency in some of these public health measures when you have victims, because they need help and they still need services. So we have to have some adjustments. The other population is with children. According to the CDC, 1 in 7 children have experienced some sort of abuse or neglect. And in 2018, about 1,770 children died because of abuse or neglect. And those living in lower socioeconomic places have a 5-fold increased risk of child abuse or neglect. So Historically, how did we find out that this was happening at the home? Usually the school, usually because they went to school and kids would talk about it, or the teachers would notice evidence of neglect. That's where a lot of the reports have been filed historically. And now the challenge of children not being in school makes it harder for educators and other staff who work with children to really know if this is happening at home. And a lot of times, even if you're doing school over video conferencing, the parent might be sitting right there. So the child is, maybe afraid to disclose what's happening at home. And the other issue is that some of these children who are at higher risk are living in homes that have what we call digital poverty, which means they don't have access to technology where teachers can get a bird's eye view of everything that's happening in the home through video conferencing. So we must make more of an effort to reach out to these children and using the telephone or other ways to try and assess the situation at home. The American Academy of Pediatrics released a statement recently that it is important to try and bring children back into the school setting to address things like child abuse and neglect, and why it's important, but doing it in a way that keeps them physically safe as well.
You said an awful lot, and one thing that really resonated for me amongst many that you just shared, so thank you for that. You talked about sort of the dismantling of a mental construct or of a construct of sorts in the best of times for people that are in abusive relationships. And that in itself, I think, probably is a very fearful situation. And I would guess that many people, fear keeps them intact to where they are anyway. And then you layer in an additional fear burden of, if I leave, if I go somewhere, will I be exposed to a virus? Will I be exposing my children to a virus? Am I right in thinking that there could be people that are in violent relationships that actually perceive themselves as safer by remaining where they are based on the pandemic?
Absolutely. I believe that's the case for a lot of people, that they don't know which fear to be more fearful of.
Yeah. Another thought that I wanted to delve into with you a little bit, and this is a lot because it really deals with the first responders and those in the medical care profession that are, whether it's in nursing or techs, if you will, respiratory technicians, anyone that's delivering care day over day to people that are impacted by COVID and what they're feeling. And I'm reading literally from your paper that you discuss increased feelings of stress, feeling traumatized, higher levels of depression and anxiety, not only putting their personal health on the line, but as well as spreading the infection to their families and partners and so forth. So it's kind of a twofold question. One, what do you think needs to be done to help healthcare workers to work through this? And two, and this didn't come from me, this came from a physician several years ago that is an emergency medicine physician. And he said to me, Fred, and we were talking about behavioral health because I wanted him to speak to it. And he said that among the number one things that physicians will protect at all costs is what they perceive to be their reputations. And his point was that there are many people that just so happens practice medicine, and so happens they're physicians by trade, will not open up and disclose problems of behavioral health magnitude because of their fear of how it will make them look in their own community among colleagues as well. So is there kind of a complex confluence there, or do you see these as completely separate questions?
No, I believe that there is a confluence. With respect to COVID itself, those who are working who are directly exposed to the infected patients, such as in emergency departments or ICUs or isolation in patient rooms, they're at greater risk for developing adverse mental health outcomes. A physician commits suicide every day in this country. So clearly, there is a mental health issue in the healthcare community that needs to be addressed. And there's numerous factors of why that is or why that's happening, but particularly with respect to this pandemic, that work of those healthcare workers, it's already highly demanding, and they are now having to make some very difficult decisions that affect them emotionally, and they've got to think about ethics, like, okay, you have 2 patients who need ECMO and you only have 1 bed, or how do you choose
Right.
which patient
Right.
gets that bed? So these are complicated decisions that have to be made, and they can be quite traumatic. The other concept that we can use with healthcare workers during this pandemic is this concept of moral injury, and that's like a distress that results of actions or inactions that violate your moral or ethical code. When you experience that kind of moral injury, you can have the symptoms you mentioned: depression, post-traumatic stress disorder, even suicidal ideation. So yes, physicians do worry about their reputation and what people think of them, and how that, if they do get treatment, how will that affect their licensing and their ability to apply for jobs. They very much worry about those things. I volunteer for an organization, it's called Physician Support Line, that was started during this pandemic, and it's run by there's over 600 volunteer psychiatrists who are manning this hotline, where physicians can call anonymously for emotional support. It's a wonderful resource, and they're trying to get the word out about it so that physicians have a place that they can call. The other thing is that there needs to be, again, leadership and systemic changes to address the mental health effects of this pandemic. So that means having like supervisors that check in with their healthcare workers, make adjustments in scheduling and other things so that they can protect the mental health. And even the supervisors and the leaders need mental health support because they're human too. So having that accessible to healthcare workers is imperative. And now we do have the benefit of the digital world. There's more research that is being done in the area of digital therapeutics and artificial intelligence techniques that can help access care better. So a lot of the app-based software can help healthcare workers access mental health resources, and telemedicine, so that their time is limited, but they are still able to get access to mental health care.
Would you have a phone number perhaps in front of you to give a shout out to the physician support line? I know you may not, but you had mentioned it. And if you did, I think it would be fine if you wanted to. Is it just physiciansupportline.com, or how would physicians access it other than Googling physician support line?
There is a number. It's 1-888-409-0141.
Would you repeat that again, please?
1-888-409-0141.
Excellent. Thank you. Thank you. I also wanted to delve into telehealth a little bit. It wasn't that long ago, and I've been in the recruiting space for about 17 years, 10 of which was with a rural, non-urban healthcare footprint in small markets specifically. And the traditional lines of service were neurology, behavioral health, stroke, and these were smaller community hospitals where it was just near impossible to get a full-time neurologist to come and live and practice, or a full-time psychiatrist or someone in the behavioral health field to come and practice, or just depending on the service line. And it was viewed as austere. I think patients kind of felt on some level, is this the best we could get? I mean, I can't even talk to a real person. I'm speaking through technology, perhaps a screen. There's no touch. It's just, somewhat austere. And I believe, and curious for your input, I feel in the last 5, 6 months, telehealth has completely fast forwarded to a whole different space, not only for today, but for the future. And I'd be curious for your perception of where it's been, where it is, and where it's going.
Yes, and it's had to become more ubiquitous because we haven't had a choice. So it has gone that this pandemic has fast forwarded our acceptance, healthcare workers' acceptance to telemedicine. When I first did telemedicine, I was so resistant to the idea because years ago, because I was like, hey, this can't take the place of a face-to-face interaction. But then I heard about the research on quality of care and patient satisfaction. So that made me more curious. And when I did it, I realized, wow, I was able to service the needs of people living in rural communities and living in places where they would not have access to a psychiatrist. I first started out with working with the developmentally delayed adult population, and some of these individuals lived in group homes or locations that were so rural and so far removed from specialist care that they weren't getting any services. A lot of them had complicated medical comorbidities. A lot of them had seizures, and they hadn't seen a neurologist in years. They hadn't seen, but they also had behavioral issues. So we didn't know if some of the seizure medicine was for a behavioral issue or for their seizures. And they would just be on these medications for years and nobody would address it. It would just be continued. So, I would finally see them and start addressing some of the polypharmacy that I was seeing. So that's when I really became a believer in the impact of telemedicine. There has been, I think until now, ongoing reluctance in the past to implement mental health interventions. And part of that has been due to the lack of acceptance by healthcare professionals and the myth that the virtual interaction may not be as effective. But now we have evidence that's contrary to that. And now, because of the current public health crisis and the anxiety about contracting the virus, a lot of healthcare professionals seem to be more accepting of it. It's likely that there will be more online work available as an alternative. And also the other thing that we're likely to see is that now that mental health institutions will see the benefits and the easiness of video conferencing and some of the other advantages, they may be more unlikely, they won't give it up. They'll want to continue using some of these digital technologies because they'll see the advantages of those.
Well, it comes down in so many sectors of commerce, supply and demand, or demand, if you will. And I think where demand was not as great, I do believe that patient demand and patient acceptance and acclimation to some extent, or perhaps a large extent, will drive the further integration and broad spectrum use of telehealth. So I think it's here to stay. And I certainly know, as an older person, if you will, that would be considered high risk at 63, I would certainly be more inclined to set up a telehealth session for something that was not critical, if you will, that didn't require hands-on or hospitalization or acute situation. Because right now, candidly, we leave our home for walks, we have our grocery brought to us, and we drive around. So right now, my wife and I are being extremely careful, and going into a provider's practice, if we didn't have to, would clearly be a top box we would be checking at this point in time. So I think the general population, is probably more accepting of it and will continue to be to be so over time. Are there any other, as we're kind of closing it down, any other thoughts that you'd like to share, perhaps, that I didn't cover? I find this discussion to be fascinating, and I hope that funding remains available for access, and I hope your message and the message of your peers is heard more regularly and perhaps more loudly, especially for the population that needs behavioral health care, as well as during stressful times like today. So please take us through a final thought, if you would.
Right before my final thought, I did want to touch on a point that you mentioned
Please.
previously about cognitive behavioral therapy.
Yes.
Cognitive behavioral therapy has a lot of research for helping with anxiety and depressive symptoms, and it can help people build coping skills during this time. It can help them even address things like insomnia. Cognitive behavioral therapy can be very useful. It can be short term. It doesn't have to be some long drawn thing if people don't want it, but it can be quite helpful. The other type of treatment is, or therapy is mindfulness based treatment that can really be helpful during this time. There's been reports that during Ebola and other outbreaks that mindfulness meditation has helped people. A study of interns completing an emergency medicine rotation. They were randomly assigned to a mindfulness training program, or just like having an extra hour of a break a week, and they showed evidence of reduction in stress and burnout during the with the participants who were in the mindfulness training. So I wanted to just put those out there as two effective types of mental health treatments that are easy to learn and can be very useful.
I'm going to interject something real quick before you get to your closing thoughts. So this goes back to a commercial probably before your time, and it's specific to cognitive behavioral therapy. And the commercial was for a product that was being sold, but it went something like, "Try it, you'll like it." So that's my own personal endorsement for cognitive behavioral therapy. I think it can work wonders, as it's provided an incredible benefit for me personally. And I will share with you, when it comes to mindfulness, my wife and I, we sit quiet regularly in the mornings and the evenings, just if nothing else, to quiet the mind, to relax, to be more present, to kind of cut the noise down. And we find it to be extremely, extremely helpful, kind of recalibrating ourselves every day. And I highly encourage, in whatever form people choose to do it, whether it's in a more spiritual capacity, or, like I say, we just sit in together in the room and we just sit quiet for 20 minutes at a time, 30 minutes. And it's amazing the therapeutic benefits we've realized.
I'm glad you do that. I'm glad you are sharing that you do that. I think the more we can teach it to others and encourage them to do so, more of a powerful effect that we can have.
Yes.
This pandemic is offering a lot of challenges to individuals and our communities, and the loss of life has been monumental and continues to climb. And it is important and imperative for us to understand who's at high risk for developing mental health symptoms, screen for those symptoms, and refer to treatment when appropriate, and try to help them have access to resources. And as a community as a whole, we must continue to combat the stigma of mental illness. We must fight misconceptions.
Yes.
And we must also target effects on racial and ethnic communities, and we must engage in a philosophy of reflection and correction.
Could not have said it better, and I will reinforce your sentiments to say, I wish that I had taken action many years ago, but I finally did, and the benefits have been amazing. So I encourage anyone that thinks that they could benefit from just having a conversation with somebody that's experienced in that space. The benefits can be remarkable. So there's no reason to suffer longer than one should based on stigmatization or fear, because those are the very things, unfortunately, that I think keep us or can keep us stuck in a place. So I want to thank you again. This has been a very, very insightful conversation for me. I hope our audience has found it likewise. And if I could ask if anyone wants to follow you or find you somewhere, be it social media or a website, where would they find you?
So Twitter is a good place to follow me, and my Twitter handle is Dr. Anandhi. So it's you spell out the word Doctor, DOCTOR, and my first name ANANDHI.
Excellent. Well, thank you again for joining us, and perhaps we can do this at a later time. And we wish you the very best. And thank you again for your insight and taking an hour to share with us your thoughts.
My pleasure. Thanks for having me.
Thank you for joining us. To subscribe to additional podcasts, visit sma.org/podcasts.